बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि व सल्लि अलैहि. Dear colleagues, this is male adult patient, almost 40-year age, with history of pain in the abdomen, which is worse during the defecation, and also often on bleeding for rectum is present. The history is for the last 7 years. He has got treatment from different doctors. Now still he is having pain in the abdomen, especially in the lower abdomen, during the which is intense, more intense during the defecation. So I'm going to scan the abdomen with a linear probe. I have placed the probe in the lower abdomen. Here, this is the left side of the abdomen at the paracolic region, and here we can appreciate this is the descending colon, large bowel. We can appreciate that this descending colon is thick walled. We can appreciate that this white dots are the lumen, which is narrowed due to the wall thickness. We can't appreciate the normal layering of the bowel wall. Normally we have 5 layers: mucosa, then muscularis mucosa, then submucosa, then muscularis propria, then the serosa. There is a clear visualization of these layers of the bowel, but here we can appreciate that due to the thickening and edema of the wall of the this descending colon, we are unable to differentiate between the layers. So there is a loss of stratification, and this whole wall is hypoechoic. So we can say that the descending colon is having thickening of the walls, edema, and loss of stratification of the layers, and with luminal narrowing. So I have freezed the image to tell you the detail of this appearance. So I'm going to defreeze the image. So now I have reached the pelvic region, and here we can appreciate this is the sigmoid colon, which is also having the same appearance. So now I am going upward. This is the descending colon, and now I have reached the left splenic flexor. So this is the splenic flexor, which is having the same appearance as the descending and sigmoid colon. And now I am scanning the transverse colon at the epigastric and region above the umbilicus. Here we can also appreciate the luminal narrowing, hypoechoic wall of the transverse colon, which is edematous, thick, and here we can appreciate the now I have reached the hepatic flexor, and then I am coming downward. So hepatic flexor is also thickward. This is the now ascending colon. I have reached the from the right hypochondrium to the right lower abdomen, right paracolic gutter region. Also the same appearance as the descending sigmoid transverse flexors. Now I have reached the cecum. This is the cecum. Here somewhat the lumen is preserved, having contents. However, the wall is also thick. Still, we can't appreciate or can't differentiate the layers of the bowel wall. Now I have reached the distal ileum, terminal ileum. This is the cecum and this is the segment of terminal ileum, which is also showing somewhat thickening, not only this region is showing somewhat, otherwise the rest of the ileum is normal looking. So in this case we have seen that this patient is having disease process involving the sigmoid colon, descending colon, then transverse colon, both flexor, splenic and hepatic. This is the small bowel which is spare. No involvement of the small bowel is seen, and also we can't appreciate any lymphadenopathy. So I was saying that whole large bowel is involved in this disease process. So we can say it is the pancolitis. And if we appreciate again, this is the terminal ileum and this is the cecum. So somewhat thickening of the, not more, enough we can say that it is there is a loss of stratification here, but somewhat. So now I am going to check the rectum. What is the position of the rectum? This segment is sigmoid colon, and this is a sigmoid colon, this one, and this is the rectum, this one. This is the rectum, and this one. It not seems to be too much, as we have seen the descending sigmoid, ascending transverse, and flexor. It seems to be relatively normal looking. We can appreciate the walls. So it means that there is a sparing of the rectum while whole large gut is involved. And this is the sigmoid. Look here. This is the sigmoid, and when we move toward the rectum, there is a lot of difference in the sigmoid, wall of the sigmoid and wall of the rectum. So, on conclusion, this is the case of ulcerative colitis that is sparing the rectum. This patient has got treatment for the last 7 years. Maybe due to the treatment, rectum may have been spared from the disease process, and this we have seen that there is a no skip lesion, means that no healthy gut is seen except rectum in this disease process. So it is a pancolitis with conclusion the ulcerative colitis that has involved the whole rectum. That have involved the whole large gut, just sparing the rectum. So this is the case of ulcerative colitis that is sparing the rectum. Thank you very much.